Hello, everyone. I'm Willis, and I'm a physical therapist. I served the Austrian trail worker around since 1997. So it's been 25 years already. So firstly, I want you all stand up, please. Stand up, please. Because before you go to the Austrian trail worker, I want you to know yourself. Which one of you think you are fit? You are fit to go. And firstly, I don't want to see you in my physio station. So the first thing I would like you to all to do is, can you raise up one leg and stand like this? It makes difference, you know? So, and then you keep this. Can you raise up your heels? 1, 2, 3, 4, 5, 6. Okay. And then change another legs. Can you hold it? Can you tighten your shoes? Okay. So thank you very much. This one is important because when you're walking in the trail, it's different. It's different. We're different from walking in the street, right? If you want to walk fast, who want to be walk fast? Which one want to finish under 18 hours? Please raise up your hand. Under 24 hours, please raise up your hand. Good, very good. And anyone want to finish under 30 hours? Very good. What is the difference? The difference is if you walk very fast, non-stop, you can finish in 24 hours. If you want to finish in 22 hours, you need a little bit jogging. But in the trail, when you jog, when you walk, you will sprain your ankle. So your shoes, you will choose a thin layer of shoes or a thick layer of shoes. Which one you should choose? It makes difference. Thick one, you walk comfortably, but it's dangerous because thick shoes, very easy to sprain your ankle like this. And then you walk, very difficult. But if you walk using the thin one, yeah, it's not comfortable. And then you will have very painful inside your toes, inside your sole, inside your ankle. And this testing is test about your proprioception. That means your balance. This balance is static. We call static balance. When you raise up the heels, down, up and down, it's a dynamic balance. It can let you know how fit you are, the chance of injury in the trail or not, okay? So if you just want to have a big meal with your support team, your target should move to 24 to 30 hours. Your support team, you need to let them know. Sometimes they wait 6 hours and only can see you 5 minutes and then you rush to go, okay? And then no more friends, don't call me again. I wait you 6 hours and then you just see me 5 minutes, okay? So that is real, okay? I try to make it fast because I hope I can finish in 20 minutes. But actually I got on 100 PowerPoint. I don't think we can get through it. So this is our physio station in checkpoint 4. We usually help them to support the sprained ankle, very tired, soft tissues, knee pain, everything. A lot of people are waiting, just like to go to yamcha, right? Go to the restaurant. Sometimes the weather is bad. It's cold and wet. Sometimes it's really, really messy, right? That is the shoes. This is our team in many years ago. And I used to be a walker, and my best time is 16 hours. Long time ago. Okay. Okay, you can see this gentlewoman. Great. And then after my work, when I look up at the sky, already sunrise. We serve a lot of events, but never mind. We'll go through today common problems in the musculoskeletal and how to choose your shoes and do some functional training and stretching and foam roller exercise. Okay, for you, I want you to bring it home. You forgot everything is okay, but I want you to know how many of you are doing weight training? Please raise up your hand. Okay, so is weight training is important? Is helpful? Yes, it does, because weight training can train up your muscles, but your weight training, the muscle is not functional. What we call is rubbish. You have a very big muscle bulk, but you are rubbish because the muscle bulk is not function in the trail. How can I make it? You train up the muscle and then you go field training. That means you go to walk, to use the muscles, and the muscle will become more functional. The time twitching the muscle, the fast, the response is quick or slow, just like this. Okay, so let's go. This is a distance. Most challengeable is 3.3 and 3.4. Why? Because this trap point is pretty long and it is continuous, go up and down, up and down, up and down. And then there's 3.7 and 8 because it's high. But actually, the main problem is here. It's not uphill. It's about downhill. You cannot imagine is I go very fit, go to the Daimoshan. Okay, I almost finished, right? Only 24 kilometers left. But the problem is when you go downhill, which muscle you are using most? Do you know that? It's your thigh muscle. No, it's not other muscle, only your thigh muscle. But when you imagine, when I'm going uphill, I already very tired to go to a 900 meters hill. And then when I downhill, 90% of the force is from this muscle to slow down, to break, take a break, not let us to fail, okay? Because when you're going down, and that downhill, when you are running, you still need 25 minutes. I run it down very fast, 20 minutes. If I very tired already just walking, it takes 45 minutes to 1 hour from Daimoshan going down to the checkpoint, okay? So when you finish the Daimoshan, don't be happy. The downhill is the hell, okay? So remember checkpoint 8, okay? So you can see the height. Actually, it's about these challenges from here to there. Here is not the problem because when you're going up, it's slow, gradually to raise up. You just climb, don't look, just do, okay? And then when you go downhill, oh, you think I go downhill, very happy. And then you found I cannot stop, I cannot stop, I cannot stop. All your muscle all started to climb, muscle climb. So the challengeable is when you use the muscle a lot, do you know after you come down, which part will get painful? The first painful is in your knee and your ITP friction syndrome. And the second thing is your sole, because most of the blisters is from this downhill, okay? So your quadricep muscle is the key point to prevent the iliotibial band friction syndrome. So, so how can we help? We just common injury management, every kind of things is I want to emphasize is the field training. You need to go every week if you want to get a better results. If I just want to get finished, okay, you get maybe 2 times a month or 1 time a month, you still have the chance to finish. Otherwise, if I'm very busy, I only can go once a month of training, if you want to finish, go dreaming, go sleep, go sleep. It's real, it's real. After you walk 70 kilometers, and then you think, why I joined this? I don't want, I want to go sleep, very sleepy. And the team still discussing, should we sleep here or 2 hours and then we walk again? So my advice is you can sleep. within 15 minutes. 15 minutes. Otherwise, your whole body will become stiff. The muscle will become stiff. Usually, stiff is describing the joint. Your joint for stiffness. But actually, in the ultra endurance walking, the hiking, the muscle will become stiff. The feeling is you never imagine is when you sit down. When you stand up, it's really difficult. All the muscle just like a sticky, very sticky muscle, all sticky together. You use a lot of energy, just cannot move the joint. That is the muscle stiffness. And weight training is good. It can train up your muscles, but it's not functional as I told. It cannot, those muscles you train up cannot use in the trail. It just simply make you heavier and make the loading heavier and make your foot more wear and tear, okay? And then your training should be progressive. So up till today, you still have 2 months time, at least. You can train up yourself. So plan your every week training. No need to be long, maybe one long train or 3 short train, that's enough. 10 kilometers to 30 for 3 times. And then 1 training for 50 kilometers at least. So at least 12 hours walk. Yeah, 12 hours walk, simply, right? So we need to go fast, right? Okay. Right. So this very complicated things is just one word, is exceed. When you will get injury, because if your loading exceed your body, but your body, everyone is different. For example, if I doing sedentary, I go office work, so my loading is very low. Once I go to the trail and then I will be maybe 10 kilometers, I already exceed my loading. But I can tell you every one of you will be overloaded because your training never be 100 kilometers, right? So your training maybe 50 or maybe 70, and other 50 kilometers is overload. And then before you get injury to your joint, hopefully you get finished. Otherwise, you get painful and then you walk like this until you finish your last 10 kilometers. So 70% is your lower limb. Within the lower limb, 70% is your knee. And then 10% is your shoelace, too tight. And then you feel, oh, my ankle, but at the front, my front of the ankle, very painful because you tied your shoelace too tight, okay? And then is the blister, because sometimes when you wearing your shoes too big, but your feet is moving inside your shoes, okay? Especially when you are going downhill. When I every time stop, and then my feet, my toes will crush to the front of the shoes. And then that will causing your bruising of your nails, toenails, right? So we saw a lot in the 20 years. So this one is your quadricep muscles. Quadricep muscle consists of 4 heads. Your hamstring muscle consists of 3 heads. Okay, let's do this. Please stand up again. So how many of you can do the stretching for the quadricep muscles? Can you do it? Very good. Just follow. Come on. Come to here. Yeah, I got a volunteer. He's very fit, okay? So can you show us? I give you my shoulder, okay? So the point is not here. The point is when you feel, are you feeling you stretch? Your key point is you need to keep your feet together, touching your other legs, okay? And then pull your knee back more. If you want to stretch, yeah, keep it together, tight it together, and then pull your knee a little bit backwards, okay? And then lastly, bend your trunk a little bit. Yeah, do you feel? Once you do each step, you will feel more tight on your front part of your thigh, okay? Okay, thank you very much. It's huge important because when you walk very, very tired and my muscle cramp, already muscle cramp, I cannot walk again. How you can restart your engine? You do this stretching. Remember, you holding like this. Sometimes you can't. Sometimes you can't. And then keep your feet together. You feel, oh, more tight. And then you pull back a little bit. Oh, more tight. And then you bend your trunk. Oh, more tight. That's good. Okay, step by step. Once you already feel stretch is enough. Don't do it until you painful. Okay, just feel tight, not painful. Otherwise, you will damage your tissues. So because different people have different flexibility, so this one is important. And then remember to hold on your bodies, because when you hold on, you can save your energy. When you are very tired, I standing like this, I doing this. Oh, my other leg, cramping. Oh, when I do this, oh, this one is good. But here, here is a muscle spasm. You feel that. And my third time to walking the trail walker, I use 2 hours, 2.5 hours. I walk checkpoint 1 and 2 already. Very fast. And then I quit because it's really hot that day. Very hot. Very, very hot. And I just jogging through all the checkpoint 1 and checkpoint 2. And I lost a lot of the electrolytes. And then I dehydrate. And then all my muscle. When I stand, I muscle cramp on the back. When I sit down, my muscle cramp. In all kind of position, I cannot make my muscle relax and I cannot walk again until I lying down 3 hours and then I can stand up again. That's why I quit. I cannot go. So it's a painful memory, you know? Okay. So overloading. When you're overloading, the main point is your joint will become swollen and painful. So what you can do, bring it home. Just do the ice therapy. But you should experience this during your training, because you never experience that. Even you go to our physio tent, your acute injury, we cannot immediately relieve 100%. We just can help you around 50 to 60% of the symptoms. The other 40%, you still need to get through it and then continue for 70 more kilometers, something like that. Okay. So that is a ITB friction syndrome. ITB friction syndrome, or let's just see the structures first. This one is the ITB. ITB is not a muscle. It's a white color, non-elastic, very, very tight tissues. It's attached to 2 muscles. One is your buttock muscles, and one is your tensor fascia lata. It means one muscle is from here, another muscle is here. You cannot stretch this fiber. This is just a fiber, very thick fiber, white color, not elastic, very tight. And what you can do is you stretch your muscle over here. Otherwise, it will come to when you are very tired, the muscle will pull on that way, the muscle pull on that way, and the whole fiber will tighten up. After you tighten up, when you walk repeatedly, and the bone here will rub the tissue. That's okay. Rub 10,000 times, that's okay. Rub 100,000 times, that seems a little bit too much, and then it will get swollen. Once you get ITB friction syndrome, we better can help you around only 60%. Other 40%, you still need to walking like this. So ITB friction syndrome, how do you know? If you cannot bend 20 degree, cannot bend. It's very painful. I cannot. And after bend 20, 30, okay, it's not painful. Only painful at 20 degree to 30 degree. And then when I fully strict, no pain, no problem. No problem. Yeah. No problem. So when you're going downstairs, you will feel I cannot walk downstairs. I walk like this. And if you see people walking like this, hey, that's ITP friction syndrome. Okay, very easy to recognize. So you see, hey, come in, hey. Then you got a good knee, huh? So the only way to prevent this is train up your muscle here. Train up your muscle here. And is anyone of you doing this? None of you. That's why you are high risk to get the ITP friction syndrome, okay? Because we need to train up the muscle over here. I will teach you how to rub that to make it better. So the green one is the ITP friction syndrome, and this one is the anterior knee pain. That means your patella. You know what is patella? Your patella bone. When you're going down, you bend and strict, walking steps. Your patella bone is rubbing on your femur bone. That means femur. When you rub a lot, and the cartilage, that is the soft bone. So soft bone, articular surface, will become swollen and very painful. So what you can do is you stretch like this, okay? So when you go upstairs, what you need your buttock muscles and your hamstring. Hamstring muscle is a free head muscle. It's from here, two muscles onto the lateral side, one muscle to the medial side. So please stretch your one leg, put on the floor, and please sit forward on your chair. Sit forward. Put one leg straight, another leg bend. Yeah. So when you bend down, you don't feel anything until you make your back straight, and then keep your straight back going down like this. Do you feel? Keep your straight back and then bend it down. Yeah. Do you feel that? And remember, do not move up your toes. Move up your toes is just simply stretch your nerve. It's damaging. Do not do that. Make your toes relax and stretch your back and keep your straight back to move forward. Can you feel the stretch only over your back of the thigh, but not stretching pain? If you move up your toes like this, you feel, more stretch. That kind of pain is a nerve pain. Do not do that, okay? Right? So simply, we almost finished because there is quite a lot coming, but it's not important. Is injury preventable? The only way is you get fit. If you're not fit, you cannot prevent injury. No matter how the technique you are good, because your injury usually is happen when you are tired. But when you walk, trail walker, you must be very tired. Okay, then it will happen. Okay, so this is all the factors will make you injury. But what you can change is only a few of them. But train up yourself. Otherwise, very difficult. And when you train, your training, do not overtrain. So this one, once you train up, your performance will go down. And you rest for 1 day, 2 days, 3 days, 4 days. Oh, it's getting better. You train up again. And then, it's the depression of your performance. And then rest 1, 2, 3, 4. Okay, just keep doing this. And then you will find the beginning is very painful, because the beginning, what you gain is only a little bit. But you keep training, don't stop. And then you will find your gain is getting more and more. So keep regular training is the key, but not very strenuous training. I do once a month, but that month I do 100 kilometers training. No, there are no effect, no carryover effect. The carryover effect is you keep training, don't stop, keep training. And then your performance will getting better and better. So the key point is keep frequently training. You do every day, walk 10 flights of stairs, just go up and then take the lift, go down. And then that is good to prevent your knee injury, okay? And then if you going downstairs also can train up your muscles. Very good. Stairs training. And the ice can help you to deal with everyday injury, because when you're training will be wear and tear, and then you keep training, that will be overload. And then the ice is cheap, easy, and no side effect. But do you know you need to do 50 minutes 3 times a day and do 3 weeks, 3, okay? 50 minutes 3 times a day and do 3 weeks, okay? Stretch. This is the foam rolling, just like a hand to rub on your muscles to help you recovery faster, just simply faster, okay? We do quite a lot. Actually, this is a video. I'm not sure. Maybe I let you see this one. The key point is you need to do it slowly. Do it slowly. You have a very good friend. He can help you to do this. That is good. If you don't have a good friend with your hands, and then you only have a foam rolling, you're just doing this to rub the muscles, it can recover much more faster. Okay. And let's see this one. This one is not only rub the ITP friction syndrome. It's not only rub your gluteus muscle as well as the piriformis. That means you see your rotation to roll to the lateral to medial, lateral to medial to roll the muscles, right? Okay. Okay, different kind. So the shoes, simple, thick or thin, not too big. You can put one finger inside that. That's just fit. Do not too tight and do not too loose. Too loose, it just make your feet moving inside you and then make your blisters in between the toes. Too thick is not good. Oh, yeah. Yeah. High arch. Is there anyone is flat feet or high foot arch? No, it's good. Okay. The problem is flat feet will easily get blisters in the middle of the sole. High foot arch will sprain ankle and blisters in the lateral aspect of the ankle and make it fast. So this is the pressure point. Okay, this is the difference when you're normally straight and you see from behind to the forward, you see it's not straight. And the insole is really important. And the shoes usually when you buy for training, 2 months, you can throw as a rubbish, because normally when you train 30 to 50 kilometers, your shoes will become lost the function, no damping, no shock absorption, and the insole will totally flat. So I usually, I buy a shoes I use for 1 year. Don't happy. You are not protected by the shoes. You're just using your own cartilage and bone as a damping. Okay, so usually 2 months. If very strenuous, actually, if the runners, the marathon runners, you know, their shoes only wearing once. After the race, they will throw. Okay, so how do you choose? You choose a different type protection and shock absorption, and usually totally 40 to 800 kilometers, the shoes will lose the functions. Okay, remember to wearing the fixed socks. The fixed socks. The fixed socks is helpful, very helpful, very helpful. Okay. Should I just train running or hiking or weight training? If you only can choose one, you choose the hiking, because hiking is much functional, and the hiking can help you to make your muscle become functional and protection. But if I cannot go hiking, I'm very busy, I just can running. Maybe at 11 o'clock to 1 o'clock at the midnight, you choose running, and do not take the lift. I live in 18th floor, so I can just walk up 18th floor and then go home. I don't need to walk down. Okay, just simply like this. Okay. Here, Do you know what is the difference? Actually, those kind of difference is totally different. This one is bouncing. The floor is soft, right? It's really easy. This one is hard, no bouncing. This one is hiking, terrain, different. This one is no propulsion, no push off, because you just lift up and then the floor will move to your next step, okay? This one is most energy saving and the most non-effective training is jogging in the treadmill. It's okay. If you know time to go running in the street, go to the treadmill. It's better than none, right? Okay, so don't go this. We need to go fast. So this study tell you after compare with the normal people, a 40-week, almost 10 months training, the weight training for the VO2 max and body composition, there are no difference. We will not change you, but it change your lean body mass. That means you are not decreasing the fat, but you just increase your lean muscle mass. Your muscle will become tightened, but not bulky, not hypertrophy. Your muscle will not become bigger, It is wrong. So, and the running economy is better. The weight training can make you more effective on hiking and running. Yeah, okay. Let's go through. This one is just your running economy affect if you can better nutrition, better resistance training, better endurance training, better environment, and better stretching, you can make your economy good, okay? Just simply like that. Okay. Somebody said, I don't want to weight train. I don't want to do muscle training because I don't want my muscle bulk up. But actually, no, because the training actually is more benefits than harm. Okay, so it can improve your endurance. It can improve your running economy. Okay, and then running too hard too often is a mistake. If that means you train too much, that is a mistake. Everyone know that. But how hard and how often, it depends on your lifestyle. Because if I'm an office worker, I jog 10 kilometers is overload for me. Okay, if you're already very fit, maybe 50 kilometers already overload, then you can train 49 kilometers like that. Okay, no time to go through this. Okay, so take home message is follow similar modes of strength training to the sprinters. That means I'm a distant runner, I'm a hiker. Do I need to do the weight training like a sprinter? Yes, you do. You do need to do the same weight training as a sprinter. Just like I running 100 meters, I do a lot of weight training. You do the same, and then it will help you to get better performance. So 80% is your normal slow speed training, and the 20% is a high speed sprinting, and then your high muscle loading training. Okay, so this one is your optimal training intensity. That means is your training actually, this area can train up your heart. You are less shortness of breath, better, but not too low, not too gentle, and not too hard. Yeah, and FITT, you know that when you're training, how do you choose how frequent, how hard, and then train how long? Maybe 1 hour, 2 hours a day, and then the type. You want to walk stairs, or you just go to the jogging, or go to the field. Okay, so no time. So almost. Functional training is important. I want you to bring home because it's a dynamic, it's related to your core stability, and it will make you less chance of get injury. So how many of you do planking? Very good. How many of you doing, okay, let's go. Let's do planking. And how about this one? This one is helping your hip. I want to let you see this. This one is good when you can do it at home. But the main point is not the legs, it's about the trunk. 99% of you, when you are doing this, your trunk will get rotated. You see, she didn't move at all, right? It's really, really difficult when you do it at home. Put a mirror in front of you or put your phone to record down. You can move the knee, open it up, and then do not move the trunk. You see, only the legs move. The hip not move, her trunk, shoulder not move. It's really difficult trying to do this. It can help you to train up to prevent the ITP friction syndrome, okay? Okay. This is the link in the Hong Kong Physiotherapists Association that you can see the 10 elementary strengthening exercise, balance, and the stretching work. You can, as a reference, to have a look. It's easy, simple, but very basic. It will highly recommend it. Okay, so this kind of thing we not go through. There are a lot of video. Dynamic stretching. Let me tell you, before the exercise, no need to do the stretching like this or like this, something like that. That kind is a static stretching. Once you plan to go to exercise, do the dynamic stretching. And after you finish your exercise, you do the stretching, just static stretching. So, something like this. Okay. So let's go fast. This is stretching, very useful. Can you do that? Just doing like this. Yeah. Everyone, can you do it? And then put your elbow on your knees. And then bend your trunk. Do you feel the stretch over your buttock, right? Yes, it's helpful, especially when you feel very tired, okay? Okay. This kind of stretching, you know that. Yeah, it's really useful when you are very tired. Because when you do stretching, the muscle stretch, the nutrition and the oxygen will be absorbed, sucked into your muscles. It can restore your muscle power, okay? It's really simple. Okay, foam rolling, and I don't go through like this. Yeah, just something. You can see the video. Yeah. All right. Just do it slowly. And the anterior part of your lower leg, and the hidden hypothermia. Sometimes when you walk very, very cool, really, really cool. Originally, will be hide under the blanket. You cannot see. Okay. So if you are beginner walker, you train up like this, the technique, endurance, and simply stretch. If you want to walk fast with the speed under 18 hours, you need the foot placement. The foot placement, route management, strategy, and the strategy with your teammates. It is key point to divide you as a beginner or advanced walker. Okay. This is the focus and the training, the cardiopulmonary, the reconditioning, and something like that. Okay. That's mine. Several years ago. Yeah. Do you know what I'm doing? I'm doing the stretching for the hamstring, for the front leg, for the right leg. If I want to stretch the legs, I put my leg forward and then bend. That is the stretching to my hamstring. Okay. Yeah. Just a summary. Just reasonable goal and get fit, prevent injury, and your training regime. And most likely you can use your logbook and listen to your body, know yourself, understand your body, train up your body, and prevent injury. Okay. So thank you. Any questions?